Hey everybody, this is Justin from Atlas, back again for the last part of our injury prevention video series surrounding getting physically active. Figured since we were talking about getting physically active, I wanted to also discuss avoiding overuse injuries and overdoing it with your physical activity. First, what is an overuse injury? An overuse injury is any type of muscle or joint injury such as tendonitis or a stress fracture that's caused by repetitive trauma. We're going to discuss causes of workplace and physical activity related overuse injuries and how to manage them. Let's talk about some of the common causes of overuse injuries. Like I mentioned in the previous slides, overuse injuries aren't only from training. They can also be caused by your work demands. Overuse injuries in the workplace are often caused by a lot of bending, lifting, driving for long periods, typing, working on an assembly line, or other motions that employees make repeatedly. The stress of these motions can cause soft tissues like ligaments and tendons to weaken, resulting in aches and pains, decrease in flexibility and strength, speed, and skill. Overuse injuries can also occur from physical activity or exercising. Training errors occur when you take too much physical activity on far too quickly, or you're going too fast and exercising too long, or simply doing too much of one type of activity. This can strain your muscles and lead to the overuse injury. Technique also is an important part of overuse injuries. Improper technique can also take its toll on your body. If you use poor form as you do a set of strength training exercises, swinging a golf club, throwing a baseball, or even driving a bus, you may overload certain muscles and cause an overuse injury. Now, how do we avoid an overuse injury? This is the most important part. In the workplace, employers must ensure they're training their employees on techniques for lifting, specific job tasks, and overall body mechanics. Your Atlas providers can help you with this. Proper gear should also be provided whenever is possible. Keyboards that are designed to help with carpal tunnel, or knee and elbow braces for employees who frequently climb, bend, and lift. Another way to avoid workplace overuse injuries is to promote and encourage your employees to stretch, take breaks from repetitive motions, and get up and walk around if they're standing, driving, or sitting all day. Whether you're starting a new activity, a new job, or you've been playing an activity or had a job for a long time, consider taking lessons on using the correct technique or talking with your Atlas provider about keeping the proper posture and using proper form for lifting, driving, bending, any type of repetitive motion that you do throughout your day. Using the correct technique is crucial to preventing overuse injuries. You should also make sure you're wearing proper shoes. Consider replacing your shoes every 250 to 500 miles that you walk or run, or at least twice a year if you regularly exercise. If you're changing the intensity or the duration of physical activity, do so gradually. For example, if you want to increase the amount of weight you're using while strength training, increase it by no more than 10% each week until you reach your new goal. If you're starting a new fitness program, avoid becoming a weekend warrior. Compressing your physical activity for a whole week into 2 days can lead to an overuse injury. Aim for 30 minutes of moderate physical activity a day. If you don't have time for a full 30 minutes, try to break it down into smaller blocks of activity throughout your day. Also, as we discussed before, take some time to warm up and cool down from your activity. Now, when it comes to cross-training, this can be helpful in avoiding overuse activities by, instead of focusing on one type of exercise, build variety into your fitness program. Incorporate low-impact activities, including walking, biking, swimming, or water jogging. These can help prevent overuse injuries by allowing your body to use different muscle groups and not overload one particular group. Now, if you do experience an overuse injury, let's talk about how to recover from it. Step 1 is going to be talk to your healthcare provider. Here at CT, I'm going to recommend coming to seeing your Atlas providers if you're experiencing any type of overuse injuries. A healthcare provider will likely ask you to take a light break from the activity that caused the injury, but you may be able to perform alternative tasks or training as long as it doesn't stress the involved body part. Make sure you tell your doctor or other healthcare provider if you've recently made changes in your workout technique, intensity, duration, frequency, or type of exercising. Identifying the cause of your overuse injury will help correct the problem and avoid repeating it. Now, if you have an overuse injury, don't let it stop you from being active completely. Instead, take the time that you need to rest, relax, and recover. Once you are recovered, focus on preventing those overuse injuries by using the tips that I gave you in the previous slide. Okay? Focus on having a rest day. Make sure you're cross-training and using proper form and technique while you're performing physical activity. As always, if you have any questions or you do experience an overuse injury, please feel free to stop by and see an Atlas provider. We can help you out with that. Thank you.